And we're back with you with Jeremy Friends. He's the infectious disease clinical pharmacy coordinator at Cone Health. We're discussing the new updated COVID boosters. And so here are several of the questions in the queue. The first one is, what's the latest guidance about mixing and matching the vaccines? You got a lot of people who had all the Moderna or had all the Pfizer, and they're wondering, should they take the other brand when it comes to the booster?
Yeah, so if you got Pfizer for your primary series, you can get either Pfizer or Moderna for your booster, whatever is convenient for you. There really isn't a strong preference that you need to stay with the same brand.
Could it offer you more protection going with the other brand, or?
Probably not. It's probably going to be about the same with whatever you want. The recommendation is just to get whatever's convenient for you. Some pharmacies don't stock both brands, so if you get it at a pharmacy, just take what they have.
Okay. All right. This next question is, kind of a follow-up. Is one booster better than the other?
Yeah, I think they're equal. They're equally efficacious as far as we know. Yeah.
Okay. This person is asking, is there anyone out there who shouldn't get a booster, even if they're eligible to get that booster?
So that's a good question. I can't think of anybody. It's really recommended for everyone who, if you want to be fully vaccinated, now that means to get this new updated booster, which will protect you from the current circulating variants.
Okay. And this next question is, what kind of data exists to prove that the booster is safe, like the vaccines?
Yeah, so the boosters that are available were made with basically the very, very similar technology to where the primary series was made. And of course, those have been given to millions of patients throughout the United States and throughout the world. So we really expect the safety profile to be just about exactly the same.
This viewer says, I remember reading that myocarditis was a concern with the first shots. Is that still true?
So myocarditis is a rare, very, very rare side effect. The thing to remember is that you can actually get myocarditis from COVID too. It's something to be aware of, and it's something that the FDA is monitoring. But everything does have some side effects, but the side effect is extremely rare. It's extremely rare. The group that gets affected the most are young men. I think it's late teen years to about 39.
And if you're concerned about that when you go to get the booster, you should be asking your doctor what those symptoms are so that you would be able to catch it quickly if something were to start to develop.
Yeah, you definitely can discuss your specific situation with your doctor. That's always a good thing to do.
All right, this next question is, can you please review the timeline of when to get the booster? If I got my most recent booster last month, right, how long do I need to wait?
So after you've gotten your booster, you need to wait 2 more months, or a total of 2 months, to get this new booster. So 2 months.
2 months is the answer. 2 months after you do your last booster, or 2 months after you get your last vaccine for the series. Is that correct? Okay. So either way, it's 2 months, no matter what. All right. This next question is, do COVID tests from last year catch the new COVID variants? Should I purchase new tests every few months?
So I believe that the COVID tests can test all the variants that are available. And as far as getting a new test, you just need to look at the expiration date on the test. So if it's still in date, you can just go with that.
And so the test, it may not tell you whether you have Omicron or whatever else. It's just going to tell you, especially the ones that you do at home, it's just going to tell you that you are either positive or negative for COVID.
Right, yeah. The tests don't specify what variant of COVID you have, just if it's a form of COVID.
Now, if you do test positive, what is the timeline with that? Because that has changed so much as well. What should you do if you test positive?
So if you test, as far as quarantining, I think you mean, so you need to quarantine at home. At least our current recommendations are for at least 5 days. And then if you're symptom-free with that, then we say you can get out and about, but you definitely need to wear a mask after that. For your specific situation, it's always good to check with your health provider if you have any health conditions that you're worried about, or if you have friends or family in your household that are more susceptible to COVID, if they have immunocompromising condition or if they're elderly.
Right, that makes sense. All right, we're going to take a quick break from our text questions. Remember, you can continue to text those questions, 336-379-5775. We're going to get updated on the forecast.